Hello guys, now in this video, let's discuss with the topic of oral contraception. Guys, we have already completed natural methods of contraception, we have completed barrier methods of contraception. Now let's continue with the oral contraceptive pills, okay, and how they are going to act and how they are going to prevent the pregnancy. Now guys, please concentrate the mechanism of action. See guys, usually the oral contraceptive pills, okay, these tablets, these oral contraceptive pills contain both estrogen as well as progesterone. Okay, so oral contraceptive pills contain estrogen as well as progesterone. So what? So how it's going to help here? See, we all know that estrogen downregulates the FSH production and progesterone downregulates the LH production. So what happens guys? So every day if the female is taking exogenous estrogens and progesterones, endogenous FSH production, LH production are hampered. So in the female body there is no FSH, there is no LH. So whenever there is no FSH, no LH, folliculogenesis, is it going to happen? No. Ovulation, is it going to happen? No. So whenever there is no folliculogenesis, no ovulation, can she become pregnant? No. Okay, so this is the mechanism of action. So both estrogen and progesterone will downregulate the production of FSH and LH. But also remember that this both in combination, estrogen and progesterone also inhibits the release of GnRH from the hypothalamus, gonadotropin releasing hormone. Okay, so what I want to put into your mind is estrogen and progesterone together is knocking out FSH production, LH production and GnRH release. Okay, so that's what's the important point to keep in mind. So ultimately there is no follicular development, there is no follicular rupture and there is no ovulation. And also this is one mechanism of action. But also remember that taking these oral contraceptive pills makes the cervical mucus of the female more thicker, so that a sperm cannot penetrate this thick cervical mucus. Okay, so taking oral contraceptive pills makes the cervical mucus thicker, so that sperm cannot penetrate it. Okay, sperm cannot penetrate it. So if it cannot penetrate, it cannot fertilize the ovum, so that there is no pregnancy. Makes cervical mucus hostile for sperms. Now, and also remember guys, taking everyday consumption of this estrogen and progesterone will cause hyperproliferation and hypersecretoriness of the uterine endometrium. Is it good? Hyperproliferated endometrium, hypersecretory endometrium. It sounds not good. Why? Because endometrium, it should proliferate and it should become secretory endometrium, but it should be in a phase. Okay, it should be in a proper phase for the proper implantation to happen. If it is too much proliferated, if it's too much secretory, then the endometrium became out of phase, and that out of phase endometrium won't favor the implantation. Okay, so even if there is ovulation, and fertilization, implantation cannot happen. Why? Because endometrium is totally out of phase. So what are the three important mechanisms of action of oral contraceptive pills guys? Oral contraceptive pills inhibits the release of FSH, LH and GnRH. Second one is oral contraceptive pills makes the cervical mucus thickened and so that a sperm cannot enter. And third mechanism of action is oral contraceptive pills makes the uterine endometrium hyperproliferated, hypersecretory and makes it out of phase so that implantation won't happen. Now note guys, as I have already mentioned that oral contraceptive pills contain both estrogen and progesterone. Now let's see one important point about the estrogen. What is the most common estrogen which is present in the oral contraceptive pill guys? See, it's ethanyl estradiol. Okay, ethanyl estradiol is the most common estrogen which is present in the oral contraceptive pills. Okay, then what about progesterones? Don't worry, we'll see it in a minute. Guys, what are the non-contraceptive benefits of oral contraceptive pills? First of all, why you are using oral contraceptive pills? Because you don't want pregnancy to happen. That's the contraceptive benefits. Other than that, non-contraceptive benefits are, see, these oral contraceptive pills prevent ovarian cancer and cysts. Okay, So using oral contraceptive pills decreases the risk of ovarian cancer and ovarian cysts, uterine or endometrial cancer, fibroids. Guys, please concentrate in mind. If there is already ovarian cancer, don't give oral contraceptive pills. But a healthy female, perfectly healthy female, if she is taking oral contraceptive pills, that will decrease the risk of developing ovarian cancer or ovarian cyst. But if already female is having ovarian cancer or endometrial cancer, in these conditions, oral contraceptive pills are contraindicated. That's what you should know. Okay, so in a healthy female, they will decreases the risk. Okay, so they are protect you against the colon cancer and benign breast diseases like fibrocystic adenomas and endometriosis, a pelvic inflammatory disease, and dysmenorrhea and menorrhagia. Okay, just in the previous lecture we just discussed that in endometriosis, continuous usage of oral contraceptive pills. Okay, continuously, female is not stopping the oral contraceptive pills. Continuously she is using the oral contraceptive pills. So what happens, guys? If a female is continuously taking estrogen progesterone, there is no progesterone withdrawal, so that there is no menstruation. That's what we decide in endometriosis. Okay, but just give me a minute. How these contraceptive pills are used? Usually, there are 28 pills in one sheet. 28 pills in one sheet. So she should take from day 1 of her menstrual cycle. Okay, and the first day is the first day of menses. So she have to take the oral contraceptive pills from the first day itself. So she should take 21 pills which are hormonal in the sheet. Okay, in that sheet, 21 pills are hormonal pills which contain estrogen and progesterone. But the last 7 pills are iron pills. Okay, so last 7 pills are iron pills. So from day 1, she is taking estrogen, progesterone till 21 days she took estrogen, progesterone supplementation. Now for the last 7 days, she is not taking any estrogen or progesterone. She is just taking iron supplementation. So what happens? We just created progesterone withdrawal state. Okay, there is no progesterone. Why? Because she is taking just oral like iron pills. Okay, so because of this progesterone withdrawal, now she will have menses. But what if she is taking this oral contraceptive pills continuously, hormonal pills, continuous taking of this oral contraceptive pills, hormonal pills? There is no progesterone withdrawal state, so that she will have amenorrhea. So that's what we decide in endometriosis. Why? Because in endometriosis, we don't want menses to happen. Why? Because whenever there is menses, there is too much of pain. So we are artificially not letting the menses to happen. Okay, now let's continue. See, oral contraceptive pills are good. Why? Because they are not letting the pregnancies to happen, and they're also good. Why? Because they are decreasing the risk of certain cancers. But remember, guys, taking these oral contraceptive pills increases the risk of getting certain cancers. For examples like cervical cancer. Okay, see, taking oral contraceptive pills increases the risk of adenocarcinoma of cervix, increases the risk of hepatic carcinoma, increases the risk of pituitary adenoma. So I should remember it like PHC. Okay, P for pituitary adenoma, H for hepatic carcinoma, and C for cervical cancer. So taking oral contraceptive pills increases the risk of which cancers? PHC. Okay, that's the mnemonic. I should remember. If you find it helpful, you can take it. Okay, no charges. Now, guys, we have already discussed what is the most common estrogen which is present in the oral contraceptive pills, guys. Most common estrogen is ethinyl estradiol. Now, what about the progesterone component? See, progesterone in OCPs are usually, first of all, the progesterones are classified into first generation, second generation, third generation, fourth generation. Okay, according to their invention into the market. See, it's very important you should know that second generation progesterones, you should know the example of a second generation progesterone, which is a very, very important drug. It's a levonorgestrel. Okay, in the exams they will ask you. Levonorgestrel is a second generation progesterone. Desogestrel is a third generation progesterone. And drosperinone, which is present in Yasmin, is example of a fourth generation progesterone. But important, what is the most commonly used estrogen in the oral contraceptive pills? It is ethinyl estradiol. And what is the most common progesterone used in the oral contraceptive pills? It is levonorgestrel. Guys, most commonly used progesterone in oral contraceptive pills is 𝐿-norgestrel. Important, very important. Okay. Now, please keep this point in mind. 𝐻𝐴SMIN contains 𝗏𝑠𝑝erinone. Why? Because in the next slide we'll be talking about this point. Okay. In the next or the other next slide we'll be discussing about the 𝐻𝐴SMIN composition. There we'll discuss that 𝗏𝑠𝑝erinone is present in the 𝐻𝐴SMIN. Okay. Now let's continue. Now, yeah, in this slide itself we are discussing important composition of some important oral contraceptive pills. Okay. For example, let's discuss about Mala-D and Mala-N. Okay, both this Mala-D and Mala-N are oral contraceptive pills which contains both estrogen as well as progesterone. So what is that estrogen, guys? We have already know this. Ethinyl estradiol. How much? How much? The concentration is 30 microgram. This concentration is very, very important. 30 microgram of ethinyl estradiol is present in Mala-D as well as Mala-N. This is estrogen component. What about the progesterone component? Levonorgestrel, second generation progesterone. It is 0.5 milligram. Okay. So, guys, one important point I want you to remember. The composition of both Mala-D and Mala-N are absolutely the same. There is no difference. But Mala-D is like, you have to buy the Mala-D. Okay, it's almost 2 rupees. Okay, it's almost 2 rupees. But Mala-N is free of cost. Okay, it's free. Mala-N is free. N for, I used to remember N for no money. Okay, so Mala-D is like, you have to pay my price for that. Now, guys, as I have already said, see, in a pack of one contraceptive, in one contraceptive pack, you will be having 28 pills. Okay, 28 pills. Out of that, 21 pills are hormonal pills and the last 7 pills are iron pills. Very, very important point to be noted is that this iron is in which form? It's a ferrous fumarate form. Okay, it's not ferrous acetate or ferrous sulfate. It's a ferrous fumarate. Okay, ferrous fumarate iron is the last 7 pills. Okay, now as I have just said, 𝐻𝐴SMIN, just remember about the 𝐻𝐴SMIN. Now we are getting 𝐻𝐴SMIN here. See, 𝐻𝐴SMIN is also a oral contraceptive pill. It also contains both estrogen as well as progesterone. Estrogen is, you all know that it is ethinyl estradiol, which is the most common estrogen. And what is the progesterone, guys? It is a 𝗏𝑠𝑝erinone, 4th generation progesterone of 3 milligram. Okay, so having said that, let's move forward. What are the absolute contraindications for the oral contraceptive pills? So, in which conditions this estrogen and progesterone containing oral contraceptive pills are not to be used? In the breast cancer. Okay, in the breast cancer. Why? Why? Because if the female is already having a breast cancer, see, if you are trying to give estrogen to her, this estrogen is a stimulant for the breast. So, that can aggravate the condition. So, in breast cancer, it's absolute contraindication. Hypertriglyceridemia and hypercholesterolemia. Usually estrogens will increase the levels of triglycerides, increases the cholesterols. If the patient is already having hypertriglyceridemia, hypercholesterolemia, don't give estrogen containing things. Okay, so that's why we won't give here. Undiagnosed vaginal bleeding. Undiagnosed vaginal bleeding means we don't know the reason why that there is a bleeding in the vagina. We don't know the reason. This bleeding might be because of endometrial cancer. If the person is already having endometrial cancer, if you are trying to give the estrogens, that's a very, very bad decision. So, in undiagnosed vaginal bleeding, don't give oral contraceptive pills. History of thromboembolic events. Why? Because, guys, estrogens are thrombogenic agents. Usually estrogens are thrombogenic agents. If the patient is already having a history of thromboembolic event or a current DVT, no estrogens. Why? Because the risk is going to be more and the person will develop stroke because of some thromboembolic event. Now, pregnancy. If the patient is having pregnancy, if you give this oral contraceptive pills, that can lead to abortion. Why? Because she is taking estrogen progesterone, but the last 7 days, because of the progesterone withdrawal, menstruation will happen. So during pregnancy, if menstruation happens, means what? That's very bad. So during pregnancy, don't give. And liver pathology, the conditions of liver pathology, don't give estrogen progesterone containing pills. Why? Why? Because estrogens and progesterones, these are metabolized in the liver. So whenever there is some liver pathology, the liver is not functioning properly, so it cannot metabolize estrogen progesterone. So estrogen progesterone concentration will build up in the body. That is very, very bad. Okay, so don't give the liver pathology. Now, what about the diabetes mellitus? Guys, estrogens and even progesterone, they have some impact on carbohydrate metabolism. Okay, especially progesterones, they have impact on the carbohydrate metabolism, so that usually the patients who are on progesterones will have hyperglycemia. Okay, a patient with a progesterone a prescription, who is on a progesterone, he will have hyperglycemia. If already the patient is having diabetes mellitus, in this condition, no estrogen progesterone pills. And smoker over 35 years of age. If a female is a smoker above 35 years of age, no OCPs. Why? Why? Because usually, remember, smoking is associated with thromboembolic events. Okay, why? Because the smoke particles will act on the endothelium of the blood vessels, causes the endothelial damage that will lead to a thrombi formation. On one hand, even estrogens are also thromboembolic agents. But when these two persons comes together, when these two bad persons come together, because of the synergistic activity, okay, when these two are kept together, there is 10-fold increase in the risk for development of thromboembolic events. So never mix a chronic smoker with the oral contraceptive pills. Why? Because definitely the person will manifest thromboembolic event, so that she can have a stroke. Okay, so I hope the oral contraceptive pill lecture is helpful. Now in the next video, we'll be discussing about some other oral contraceptive pills which are slightly different from which we have discussed right now. Guys, just wait. Now we just discussed estrogen plus progesterone containing oral contraceptive pills. Now in next upcoming video, we will be discussing the oral contraceptive pills which do not have estrogen but only progesterone. Thank you.